Take some big breaths, feel your shoulders fall. Welcome to Momentous Chiropractic. I'm Dr. Jaskinia.
This is Justin.
Today I'm here with Justin. He's experiencing some right shoulder pain, so I figured I would take him through a full spine adjustment today with an analysis so that you can see what our normal treatment process is like. So Justin, tell me a little bit about your shoulder, what you've been experiencing with working out, what that's been feeling like for you.
Yeah, on a day-to-day basis, the tightness just shows up across the top of the shoulder. When I try to mobilize it, there's like a little clicking up around the collarbone. And the movements that bother it the most is just a strict overhead press, or even sometimes just a push-up or bench press.
Okay.
I kind of feel it in that same spot.
Which is kind of a big deal because he likes to work out, he owns a gym. What are you kind of experiencing with any overhead press with weight?
Really, it's just tightness.
Okay.
The pain isn't too acute. The clicking doesn't happen when I go overhead.
Okay.
Well, it happened there
Yeah.
as I just came down from that position. But no, like I'm still able to feel stable in the joint overhead, but there's just this kind of nagging tightness that makes me feel like there might be something out of alignment.
Cool. And Justin's been working with me for a while now. When he first started, there was a little bit more of the sharp pain within the joint, and then a little bit more of the dull, achy pain with maybe after a heavy chest or shoulder workout. So that's progressively gotten better over time, and now he's just experiencing a little bit of joint dysfunction. So now I'm gonna have him lay on the table for me, buddy.
Mm-hmm. Face down?
Yep, face down. And we're gonna go through a spinal exam. When we get to the shoulder, we'll do a little bit extra analysis of that so that you can kind of see inside my brain of what I'm looking for on an adjustment. All right, so first thing is I'm gonna look at how his body's laying on the table. Is there any asymmetry from side to side with the musculature? Is his pelvis shifted in one direction or the other? Is he showing up with one short leg or one long leg? Which today, if you wanna catch this for me, Heather. So check out Justin's feet here. Not my feet, Justin's feet. So his left leg is showing up shorter by about a half of an inch. Can you see that pretty good on that? So we'll do that. We'll do that before the adjustment, and then we'll see if we can get any changes afterwards. As I'm looking at his spine and his pelvis, I'm seeing that his pelvis is shifted this way. So there's a rotation going this way, and his left hip is rocking up off the table. So without doing any more analysis than that, it's very common to see a short leg on the side of posteriority within the pelvis, which if the hip is shifted backwards, it shortens the glute, shortens the hamstring, the calf, and the Achilles, and it makes that leg appear like it's short. So not only can that make him more susceptible to musculoskeletal symptoms, low back pain, things like that, but it's also gonna hinder his performance in the gym. So we gotta make sure that we get him squared away here. So going through a spinal exam, all I'm doing is I'm trying to feel where he's holding any excess tension and tone. It's very common that if this hip rocks backward, it's gonna take the rib cage with it. So, and that's what I'm experiencing here, is there's more hypertonic, tight muscles here on the left lower rib cage. Maybe tip your head back a little bit. So there's a little bit of compression here at the top of his back, which is pretty common nowadays. His isn't as bad as I normally see when people have a lot of anterior head carriage, but that can affect even lower down into the low back and pelvis as well. So we'll want to take care of that. His ears look pretty level, which tells me that his occiput's in a good position. There's a little bit of posteriority of this left occiput. Okay. All right, Justin, come on up for me and have a seat. I'm gonna check your shoulder out really quick. Swing your legs this way for me. All right, so we're gonna start with the unaffected arm, the arm that's moving well. I'm gonna have you reach across your chest, Drop your elbow down and then bring your elbow all the way up. So what I'm looking for there is him not to cheat too much over here, which is what he's doing a good job of that. And I want to see how high he's able to get his elbow up. Now try that with this side. So a little bit more restricted there. So this is called Dugas test. This is to test for anterior displacement of the humerus on this side. Okay, so it's pretty common that the shoulder will shift forward there. Now I'm gonna have you take the left arm. You're gonna reach up and over and touch the opposite shoulder blade. Heather, could you swivel around this way for me? Okay, so do that one more time for me. So he's able to touch the opposite shoulder blade. Now you're gonna reach up and under on this side and see if you can reach the inferior border of your scapula there. Okay, he gets pretty close. There's probably a 2-finger width difference there. Now try with this side for me. Good. Now reach up and underneath. Good. Not too bad with that. Now the last one that we're going to do is take this arm. You're going to put it into the small of your back and try to lift that out backwards. We're looking to see how much distance he's able to get here. Now switch sides. Good. Okay. It's a little bit more uncomfortable on the right side, Justin.
Yeah.
Okay. But distance was pretty decent. All right, go back on your belly for me. So that just gives me some good information, some good objective information about why he's experiencing what he feels in that right arm. As I flex the heels up to his pelvis, I'm looking for how well his hips are moving in space. And now I'm just testing to see how much mobility he has in his pelvis. Yeah, this hip is definitely shifted backward. And then when I'm pressing down on that to put it into a better position, does that have an impact on the rest of the system? So when I push down on the pelvis, the underlying tone of these muscles starts to get better. So as I put the joint into a better position before an adjustment, definitely starts to relax a little bit. All right, so we're gonna start with your pelvis. Lay on your side for me, face me this way, please. All right, so with this adjustment, you'll kind of be right here for me. So when you're, back up just a little bit. So when your hip has gone backwards, what it does to your sacrum is it rocks it back in this direction, okay? So what you're gonna see me do is start to bring that energy back into the left side of his body. I'm gonna roll you over, Justin. I won't drop you, buddy. Nice. Yeah. The other side for me, please. That moved really great. And then we'll do the posterior hip. So same thing here. This hip has gone backwards, okay? So it's not overly complicated here to figure out what we need to do. It's just make sure it's going in the right vector, the right direction here. So I'm gonna take my hand, close the hip down. I got you. Just let your legs relax for me. Mm-hmm. Perfect. On your back for me.
Feel good.
How'd that feel?
Good.
Yeah, it moved really great. Mm-hmm. Actually, flip over on your tummy for me. Let's check your feet real quick before I forget. All right, so no manipulation or anything. This is just gonna be in the moment how his feet responding. So much better. So before, this one was short by about 1/2 inch. So can you get that pretty good? That looks pretty even to me. His socks are kind of throwing this off a little bit, but that's pretty even. That's awesome. Okay, flip over onto your back for me again, Justin.
Yes, sir.
So an issue like a right shoulder is never just a right shoulder. We got to make sure that the whole system is cleared so that that brain-to-body connection through the nervous system is restored to normal physiological range, okay? So chiropractors aren't just moving bones. It's not a bone problem, it's a nerve problem. So we have to put the bones in the right position so that that improves the communication, gets rid of the stress, the tension, compression from his body that's not allowing his body to perform optimally. So I'm looking for internal rotation of his femur, the ball and socket joint of his hip. This one's moving pretty well. This one's a little bit more stuck and restricted. I'm not able to bring this one into as much internal rotation. So this is a pull at his foot, but I'm actually looking to gap the ball and socket joint of the hip just to reset those muscles there. Better. Perfect.
Feels much better.
Perfect tone there. Check the heels, especially on the affected side, on that hip. It's very common that you'll get tight and contracted Achilles on that side, which drags the calcaneus, which is the heel bone, up, and you need that to move. So when your foot hits the ground when you're walking, your heel bone should be coming laterally a little bit so that you can access the inside part of your foot. I see this a lot is most people are lacking good heel mobility, which affects your walking gait. So I'm just gonna use this little drop here, and I'm gonna decompress down the table with a little bit of an outward drag of the heel. There we go. This is the foot, or this was the leg that was shorter in the beginning. So we got to make sure that we're restoring the biomechanics of the foot, the ankle, the knee, the hip, so that he can keep crushing it at the gym. All right, so we have an idea of what's going on in the shoulder. We had him test it actively earlier. Now I'm going to test it passively, where he doesn't need to do anything except for let me move the shoulder. And I like to compare the affected side with the unaffected side so I can see what his normal anatomy is. He's lacking a little bit of external rotation on the right side. So this one moves really nice. Justin takes good care of his body. This one, it's pretty good, but we can help him out a bit. And then tied in with the shoulder, as we're looking at the lower arm as well. Palms up in this position is good anatomical position. A lot of times if you have an anteriorly rolled shoulder, you'll see somebody more likely to be in a palms down position, which is less, it's a decreased biomechanical optimization. So along with the shoulder, we'll be working on the forearm as well. So I'm feeling underneath his rib cage to see where he's holding some tension. He's been doing a pretty good job of keeping this shoulder healthy, so it's moving pretty well. But I'm right inside of his shoulder blade on the right side, right next to his spine. I'm gonna take my left hand here that's underneath him, and I'm gonna be pushing this way. So my left hand is gonna be going that way. My right hand is gonna be going this way to shear that joint and open it up to give him more mobility. Big breath in here, buddy. There we go. It moved great. May not have been able to hear that one too well, but it moved awesome.
I heard it. That microphone probably picked it up.
That might have, yeah. Okay, so now let's check the forearm. So I want his ulna, when your arm gets stuck in this position, it takes that ulna and it drops it down. So I want to lift it back up just by bringing some light force through the elbow. Getting back to full range of motion. We'll clear his hand out. Okay. Make sure he's got good neurological input on both hands here. There we go. Now we'll check the neck here. All right, Justin, take some breaths for me, buddy. It's very important that when you're working on someone's shoulder that you address the neck as well, because the nerves that leave the neck is what innervates the shoulder. So if I just work on the shoulder, but I'm not addressing the neck, I can miss a lot of healing potential there. So we're going to be at C5 on the left. That's the nerve that innervates the shoulder on the right. Justin, I'm just going to have you drop your head, take some big breaths, feel your shoulders fall. Perfect. Perfect. All right, and then pick your head up for me. We're gonna do the Y strap pretty lightly. He moves pretty good, so I don't need to pull real hard. But the best part about this is he's real buff. He's got lots of muscle. And when that happens, that can really cause lots of tension between his shoulder blades and to like right at the base of his neck. And so this adjustment's really great for creating length and decompressing his spine, especially if you work out a lot. You need a good amount of decompression, otherwise you're gonna be feeling the effects of that. Does that feel comfortable okay right there? Right. Okay. Big breath in here for me. Good, take a breath there. Awesome. Good. Take some breaths there for me. That can be a really powerful adjustment. So I'm usually pretty conservative with that one. I don't want to try to remove his head from his shoulders. His wife would get really mad at me if that happened.
She might not.
She might not. She might not. Take a couple big breaths. I'm looking for the tone now. The tone in his upper body is really good. His body seemed to like that adjustment pretty well. I'm gonna check his cranial system here real quick. Good. All right, Justin, come on up here, buddy. All right, so he's been with me for, several months now. And so obviously in the beginning, his physical symptoms that he was experiencing were a lot different. Can you speak to what changes you've noticed in the gym that you can maybe give some people some hope that love working out, that maybe because of the physical symptoms that they've been experiencing, didn't think that they could work out anymore?
Yeah. Yeah, when I first started seeing you, I could tell that the first few days after the adjustment, function was 100% pain-free. And maybe as like a week or week and a half went by, it's like, there's still like that little nagging thing. And then after a few weeks of working with you, then it was like, it would last for a couple weeks. Yep. And then 3 weeks and closer to a month. So now the dysfunction or the pain is a lot less frequent. And honestly, it's like, it's hard to remember what the pain was like at the beginning because I still feel like that little thing from time to time, but this is, 3-4 weeks since I've seen you last. And it's barely a nuisance. Yep. So yeah, it's hard to remember exactly how tight it was.
Yeah, and a big thing is most people look at chiropractors like they're pain doctors. I don't want to be known as that. I want to be known as a performance optimizer. So I love having this guy in here and hearing his success stories because that's what this should be about. It shouldn't be just about pain. It should be getting you back to doing what you love with an improved function, because when we're pain-free and we're able to do what we love, we're a much happier person because of it. So if you like this video and you want to see more, like and subscribe. We appreciate you, and we'll see you soon. Thanks.